Hold on just a second. I need to make sure this is muted. All right, there we go. Okay. So let me bring up our presentation. Oh no. Oh no, 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 no. It did this to him on Monday. It froze. Sorry about that. It froze on me again. It did this to me on Monday, didn't it? Oh, crazy. Okay, let's try and get this going again. All right, let's try this again. All right, it's letting me share. All right, here we go. All right. So our topic for tonight that we'll get through tonight is on attending. And we talked about this briefly in the first of the semester. We went through those acronyms pretty quickly about what attending skills are and whatnot. So, and now we're just going to go into more depth about this. Now, attending is important because within especially the group setting, we have to be completely there for the full time that we're in that group session. And I'm even going to say this, even in your individual sessions, if you work with individuals, we have to have that ability to be there and be present the entire time. The problem is that human beings are not biologically wired to be attentive for a very long period of time. Um, for example, I bring up this example in the Psychology 101 class. If anyone has ever had the experience of you heard a really excellent lecture and you feel like you remember it all and stuff, and so you want to go talk about it with your friends and your family or whoever, a coworker, and for some reason the lecture just doesn't sound as it did when you were originally listening to it. That's because, and don't blame yourself for this, that's because we know that within an hour period of time of listening to a lecture or watching a TV show, while we have memory traces of doing that, we actually will only remember about 15 to 20 minutes of that complete hour. The reason being is that our biology, because of the way our nervous system works, if we try to attend to one thing for too long, the neurons that are being used to pay attention to that wear off. And so you need to shift your attention. And where do we shift our attention? It's to what we call the default network. Okay. Whenever you're not thinking about thinking, so thinking about a topic that you learned in class, studying in your textbook, doing a math problem, writing a business plan, there's a system that comes on automatically, and it's called the default network. And to give you kind of an idea of how rapidly we can go to this, in some of the research, we'll have individuals do math problems, and we'll be measuring their brain activity. And we find that even when we have individuals stop a math problem, so we say begin, right? and then we tell them to stop the math problem and don't resume until we say begin again, okay? We find that even when that time is down to 1.5 seconds, the brain automatically switches to the default network, okay? Now, what is comprised of the default network? The default network is a network that involves thinking about others, not the people you're there with, not necessarily the interaction you're having with that individual, but thinking about yourself, probably thinking about what your kids are doing, who you're going to go hang out with after work, and those types of things, okay? And you'll probably notice that during a very intense situation, you may find yourself switching off to that default network. I'd be willing to bet everyone understands this because I'm sure some of you have already faded off to thinking about what you're going to do after class or something that's going on with a partner or something like that. Don't be embarrassed by it. I know that it happens. Okay. The reason why we want to really bring about our attending skills is that even though we know this is happening biologically, when you have individuals that are hypersensitive to the topics and the situations that they're talking about and they're expressing, they notice these shifts in attention. If you've ever been kind of really upset with someone and you're really anxious about them and you're interacting with them, you might find yourself every time they look away, they're like, why are you looking away from me? Hey, you're paying attention to me right now. And so if you've ever experienced that, you kind of understand when you're really hyper vigilant and talking about very intense subjects, it's very easy for an individual to pick up on even those non-purposeful or biological adjustments in attention. Okay, so let's go through this. And so again, if we give a definition of attending, it's being attentive means that the counselor is giving the client their full focus and paying attention to what the client is saying, doing, the tone of their voice used, and their body language, meaning that our complete focus should be on that client and what we're attending to as far as what they're doing. You probably all have heard that 90% of communication is nonverbal. And that's why we don't always want to rely on voice or what's said. Now, and so body language is very important. Now, in our modern age, you probably have heard about, online counseling where you're not actually video with someone or the texting, counseling and those kinds of things. Those are quite a bit different than what we're talking about when we're doing in a group setting. I know some people who did some anger management on Zoom during the COVID period, and it was very difficult for that therapist to connect with that group. So those are all things to consider when you're thinking about modality. That yes, we are finding that clients are more willing to open up if it's via text or via voice voice call, and those types of things, but we're not always getting the full understanding. So you have to watch those things if you choose one of those modalities of treatment. So what are some of the components? We went through the whole acronym encourages last time. There's a couple that I want to focus on as far as going more into depth. First one is, of course, eye contact. Okay. And again, I mentioned that, in Western culture, eye contact is an important thing. It's telling someone that you're attending to them, and those types of things. But when we get outside of Western cultures, we have to be very aware of the cultural expectations. because for example, in uh, some Asian cultures, it's if you're a male therapist, it's actually considered disrespectful for the female to look you into the eyes or look at you in your eyes or above your nasal area. So those are all things to kind of keep in mind.
Mr.
Um,
Peterson, can I
yeah,
say something?
yeah.
It's the same way in the Apache culture also.
Oh yeah.
Yeah, in some ways, they you don't give eye contact to another Apache person, or they usually mainly in the older Apache people, they don't give you direct eye contact.
Okay. Yeah, so I think that's an excellent example of knowing your local culture, right? And understanding what that is. And I think, thank you for that example. It's an excellent example. When I first started working at TOCC, I was told that it takes a while to build trust with your students. So don't expect much eye contact. Don't expect much uh, talking out loud or I should say answering questions, those types of things, until you've taken the time to prove that you'll be there and you're just not gonna and you're trustworthy. Um, and so that's something that I know, at least with the Tana Otham community that I've worked with, that's been one of the things that, as an outsider, I've been told to expect. So it's really interesting, and it's important to look at who you're treating. And I appreciate that example. That's a great example. Um, Now on that end, one technique that does work if you do want to, make sure that the client is knows that you're attending to them visually. Okay. Especially dealing with, cultures who do not maintain eye contact, um, is that you can always, there's something called staring at the third eye. Okay, if you take your eyes, you go to the center of your nose and you do about a half a pinky up. It's almost like it's in the middle of your forehead. It's kind of, when you crinkle your eyes, like when you're really annoyed with something, and where that crinkle goes down. Um, if you stare there instead of staring directly in the eyes, it actually, for people who like eye contact, it feels like you're giving the eye contact that you should be. If it's not someone who likes eye contact, or it's culturally inappropriate, they know that you're just attending to them. And so that's been a trick. I don't want to say a trick. It's been well researched, but that's one way to consider letting your client know that you're visually attending to them, is focus on that little area in the forehead instead. um, Body language is another issue, and so this time we're going to talk from the client's perspective and not ours, because I talked about earlier in the course how we should have an open stance. We should watch when we kind of start to enclose ourselves and go into the fetal position and those kinds of things. With that, we need to look for the same thing with our client, okay? Because that tells us a lot where they're at, is when the individuals start to shift. There's actually a number to this. If a client shifts more than 45 degrees from you, there's something wrong. And you can kind of see this in gestures of if they start to withdraw, or if they start to put both their legs to one side of the chair, if they start to get distance from you in some way. Those are all ways you can tell through body language that they're getting uncomfortable with what's being talked about. Okay. The other part of it is just like I said, if they start going inward into more of a fetal position, that also denotes that they're triggering to something, which you need to be careful of. Because one, they might just be uncomfortable by shifting their body direction. But if they're going into, they're enclosing into themselves, crossing their arms and hunching over, that's a sign that they're triggering to something that has to do something with trauma that has occurred in their past. And it's important to kind of slow down and kind of note that and say, hey, I notice that you're feeling uncomfortable with this and whatnot. And again, when do you know your clients are comfortable with you is when um, they have that kind of more open stance. Appropriately, of course, we have to consider women with dresses and all those types of things, but they're more in an open stance. They keep their arms more to their side, and they become what we call animated. So they start using their hands as gestures, and their face becomes more animated. Then we know that they're engaged in the conversation. Now, with that, you got to be careful where your conversation is going, because they can become animated like that if you're going down to something that is upsetting them. So you got to kind of got to gauge that, because they can get very animated into anger as well. Okay. Gestures. This is something that, again, is something that needs to be very individualized for your client. Okay. One of the things when people come into your group or you meet with someone one-on-one is note their gestures. Note when they're becoming discomfortable, uncomfortable. Notice what happens when they're saying something that's happy or joyful. A lot of individuals who have experienced a lot of anxiety or whatnot, when something anxious comes up, they'll start to move their leg rapidly up and down, and note those kind of things. Because there are some individuals who will do the leg thing, but they're perfectly fine. It's just a stemming activity that they're doing. If you want to think about it, and I'm not saying this, I'm saying everybody has a little bit of autism in them. And some people who are just feeling a little bit anxious will start stemming their leg. So the point of looking at gestures is seeing when those things are happening. When do they make certain gestures, so that you can really pick up on where you're going with your conversation. Okay. Facial expressions. Now, this is an interesting topic that we'll get into in a little while. I'm leaving this one about how accurate we are in determining a person's facial expressions. And so I'm going to put a cliffhanger by this, because I want us to look at a little bit of research, maybe do a little bit of an activity on facial expressions, just to test our abilities in that end. I will tell you that human beings are fairly accurate with facial expressions, but sometimes we make mistakes, especially when we're dealing with individuals of different personalities and those types of things. So, but we'll get into this one, put a little cliffhanger note by it, that we're going to come back to that one. And then, of course, tone of voice. Now, just like the eye contact scenario, there are some cultural things that I want you to make sure you know about your local culture, or that the community you're working with. Because, for example, there are some cultures or some communities that speak very monotone, and they don't have a real affect in their voice. And in fact, there was research done by a sociologist to a village in the Mediterranean. I can't remember if it was an island off of Greece or Italy, but these individuals have a very flat uh, vocal expression. They all kind of, speak very blah, blah, blah. And originally, the sociologists that went to this place assumed that this must be the most depressing place on earth. because everyone just talked in that gray monotone voice. But then when they went in to measure it, they were actually just as happy as any of the other European countries or islands in the Mediterranean. So there was actually no difference in happiness, for example, or any higher levels of depression. It's just this was part of their culture. They didn't have emotional inflections to their voices. Okay. I say that's an extreme example, but again, I encourage you to look at your local culture and who you're working with to really understand tone of voice or yeah, tone of voice, and become tuned to that. Because again, if we go back to the sociologist example, the members in the community could tell how someone that felt based on how they talked. But an outsider going into that community couldn't tell at all. Okay. And that's something he noted in his case studies. And so it's important to understand the tone of voice that is used within a community and with who you're working for, and make sure that you're matching that. I have seen in supervision where I have a very spry and excited, and it's very much in her voice that she's there to help and really, and has a very low toned client. And the client's like, I need a different provider. That she or he, it's done with both, or it's too high tone. I've heard that. And then I've also heard where, a client will come to me as a supervisor of a therapist or a social worker, and they'll say, I think he's depressed or that she's depressed because I go in and they're just really low toned. Okay. And this is why it's important to match your client's tone of voice and to learn how they use their tone when they're expressing positive things, negative things, and become in tuned into those. Does that make sense for those five? Trying to use silence, so I'm preparing for a week or about a week from now. So trying.
I have a question. Can you
Yes.
hear me? Okay. So I came in late, I apologize. We're identifying the tone of voice. Is that what you were just talking about? We're identifying, remember I can't even talk, identifying the tone of voice to get an understanding and make sure we're not misevaluating them.
Yes. Yeah, and that's really why you want to look at tone of voice, and make sure that you're connecting their tone of voice. Really, if you want to think about this tone of voice, and probably why it's number 5 on the list, is if their tone isn't matching say their facial expression, their gesture, or their body language, then we need to adjust how we're evaluating that client. So if they're a low tone person, but they smile, we might misinterpret where that client is coming from. So we have to adjust how we're understanding that tone of their voice. Does that make sense?
Mr. Peterson, I have a question also.
Yeah, Lucia.
Is adult different than children in all of these process components?
How many keys do you have in there now?
Oh my goodness, that is an excellent question, because sometimes I wish that we should have 2 classes. We should have a group process for children and adolescents and ones for adult. And I appreciate you bringing up this topic. Most of what we talked about really apply to probably late adolescence into young adulthood and into adulthood. When it comes to young children, probably the most important things that we want to pay attention to our body language, gestures, and facial expressions. Because when we're working with children, either in the group setting or the individual setting, because of things like their attention span, their interest, all of these things, they can go all over the place. Okay. For example, a common play therapy, you provide the child with a choice of stimuli. All right. And usually, what stimuli are they going to go to? One that they're familiar with, that they're used to, that they're okay with. But then as the therapist, you're then going to explore their thought processes, right? But you can't necessarily see that, a child who's drawing something traumatic might be having a smile on their face because they're doing something that they enjoy, but they're also processing information through that art. Okay, so Lucia, you're the same thing with adolescents, especially dealing with adolescents in the group setting. Because adolescents in the group setting, you're really dealing with individuals who are going to want to conform to individuals who have similar identities to them. So in the beginning of an adolescent group, they're trying to figure out if I fit in here or not. And so they're going to kind of be rejective of the social norms. But as they progress, as they go, okay, we all have an eating disorder, or we all have an addiction disorder, and they realize that they have a similar identity, then their body language starts to conform with each other much more than an adult in adult setting. So absolutely, you have to look at that based on the age population that you're working with. Is there any other questions on that? Because that's an excellent question. Or comments? Okay. Let's go ahead. So that's the attending part that I want to talk about. And like I said, we're going to come back to facial expressions. And then I may add on here a little bit as we move along more about children and adolescents, because I think that would be important to look at. But later on, once we get through rapport, we'll actually watch a couple of videos on this interaction, and hopefully see some of these adjustments as a counselor watches a client, and you'll be able to see these a little bit more. But just for a few minutes, let's talk about rapport building, because this is really a skill that I want to make sure that everyone starts to practice. Some of you are probably natural at it. If you're like me, you got to work at it. But it's about what it is about is building that relationship, that respectful relationship. We talk a lot about building the client provider relationship. And this relationship should have elements of interpersonal intimacy, not couple intimacy, but more like intimacy you have with a very close friend or family member. It should have a lot of empathy. It should have a lot of these things that are really associated with what you would consider a close, emotional, intimate relationship with someone else other than a provider. Rapport comes in to say, let's build this relationship, but let's remember who we are, what we're here for, and what our professional relationship is all about. Okay. So let's go through a few of these slides for tonight, just to kind of introduce it. So rapport is meant to work well with a client. We need to establish it with them. Okay. And no matter what model the counselor you use, so if you use a cognitive behavioral approach, if you use a trauma-informed approach, if you use a EMDR approach or any of those other acronyms of treatments that are out there. This is something that every counselor has to do. I mentioned at the beginning of the class when we were talking about theories, I brought up the humanistic theory, right? About building that initial connection. And I mentioned that 99% of all therapists start with that approach, okay? And, you know, in a basic sense, rapport means a sense of having connection with another person. It's that sense that I can pick up the phone and I can call a friend, for example, or that if I show up to my group, you're going to be there and you're going to be there for me and my other group members, okay? This will be helped and facilitated by how the counselor manages their own feelings towards the client and how they behave with the client, okay? And again, I'm going to go back to my example of humanistic theory, and I'm going to go back to my example with, I can't remember his name, Maslow. His name just his name just escaped my mind, but it was the individual that talked about unconditional positive regard. Okay. And what is that? It's when a person has such a sense of themselves, they have a complete idea of what all their good qualities, they have a complete idea of all of their faults and their bad qualities, and they accept themselves completely for all of that. So they accept responsibility for their downfalls, and they accept responsibility for their successes. Okay. Only when we come to that complete sense of self can we live a life with what Carl Rogers, that's his name, Carl Rogers called a complete or authentic self. Okay. Because when we can accept ourselves completely, and when we can take responsibility for ourselves, our good qualities, bad qualities, good actions, bad actions, then and only then can we accept others for their bad qualities, for their good qualities, for who they are. Meaning that if we put it in Rogerian terms, it's being able to live without prejudice. That we see that a person can have good qualities, they can have bad qualities, but that doesn't totally define who they are. Often when I talk about this in intro to psychology classes, I talk about this is the individual that understands that a police officer can do bad things. They can drive drunk. They can do drugs. They can, police departments have one of the highest rates of domestic violence. Okay, so here they're doing one duty that people prize and say is good, but they also can be engaging in all of these other, what you would consider anti to who they are behaviors. Okay, working with inmates, for example. I had a good friend who worked with people like pedophiles, who most people would say, I hear it all the time, they need to be electrocuted, they need to be taken out and shot, all of those kinds of things. And understanding the emotions of that, and understanding that that is a highly emotional topic is understandable. But he always said, well, yes, they have this one really bad negative aspect of them, and they know it, but they also have, some of them are really good at work. Some of them are community members. Some of them they do all of these other things that are counter to that, that impression that people define a person as. And this is what is meant in the first building of rapport, is it's understanding your own feelings towards your clients and how you need to take that and behave with that client, because you're not going to like everyone you work with. Okay? Even the people who can accept inmates and know they have good and bad qualities. There's always going to be some within that population that they're going to, I don't want to work with that person. Not because of their crime, not because of their good qualities. It's just their personality, those kinds of features. I have a hard time with. Okay. So part of rapport building is one, understanding yourself and understanding how your own attitudes, biases, prejudices, schemas, your kind of basic representations of individuals, all of those things, and how that translates to how you behave to your client. Okay. And I always say, you know, before you go into the counseling room or the group room, you should kind of visually imagine you taking your biases and your own personal issues and you set them outside the group and counseling room, and then you go in. And so that you know, and you know that you're behaving towards your client in an appropriate, helpful manner. So what is rapport building? And I think we'll finish up with this tonight because I don't want to get too far. Rapport building is being well prepared for your sessions, okay? Meaning that you don't rush in, you're not finishing up your last client's notes before they come in and you say, okay, hold on, just sit there for a minute. It's not letting your own issues and problems out of the way for that duration of that session or that duration of that group, okay? So being well prepared, and we'll get into this, is making sure that you've already prepared for that group, that the room's prepared, that you've taken the time beforehand to make sure all of the materials are there. In the first few sessions, it's taking some time and remembering and reviewing your client's files. And especially for at least the first 3 or 4 sessions, going back and going through and reviewing what your clients have been through and what they're coming to you with. Okay. And again, this is your own issues and problems out of the way. This is, again, that imaginary bag of stuff. Your argument with your spouse, your late on your car payment, your buying a new house, all of that. You take that and you put it right outside the door before you go in. But we'll get into preparing for a session a little bit later with a little bit more detailed list as we move. So make a safe and trusting environment. Includes taking the trouble to make sure the setting is appealing, that it's restful, it's clean, it's uncluttered, it's a pleasant setting, provides seating, maybe a cup of tea or coffee, and ensure there's absolutely no intrusions in the room. And I'm just gonna mention this in our field, because we spend so much time in our offices and so much time at our work. We want it to kind of feel like our home and stuff. And so we have this tendency, not all, I'm not gonna say we all have this issue, to put up all of these knickknacks and all of these posters and you know, all of these different you know, the little 8-ball that you shake and it gives you your fortune, all of these things all over our office. And that is a huge distraction for an effective client session. Yes, it may look enticing and happy and joyful, and the little bobbleheads and all that kind of stuff are cool, but it can become very distractive in the therapeutic session. In fact, if I think it is, oh no, I think I'm using a Family Guy example or something like that. There's someone sitting in a counseling room. I can't remember what show it is. And the person is asking him, or I think it was him, a question. And he looked at his books and used book titles to answer all the questions. That's kind of a funny way to kind of bring this point home about making sure your environment is restful, clean, uncluttered, and pleasant. and not stimulating. This is one issue going back to the earlier question about children. Okay, we have found that especially in the therapy setting, having the three primary colors everywhere on the walls and on the floor, all over the room, and it being all colorful and rainbows and all of that really interrupts the therapeutic process for a child. Okay, what we have found is that the room should be warming. It should have neutral color. It shouldn't have more than two neutral colors ultimately. The flooring should be a neutral color. And the stimuli, if it is colorful, should be what you're using for that therapy, whether it be toy therapy, art therapy, or the like. And so if you think of a little kid and what they go through, and then you go into adulthood, we're not much different, I don't think, as we grow older. So keep that in mind as you think about your environment and where you're bringing individuals into. Okay. And then we'll end with this: be aware of who the client is. Included for second and follow-on sessions, I mentioned reviewing files especially is important, knowing the client's name, remembering key things about their issues through taking the time to read last week's notes. And this gets back to what we talked about in the beginning of this semester about note-taking, is you don't want to take a lot of notes during the session. If it's a group thing, usually group sessions have breaks. That's your opportunity to take notes. And so this, I just wanted to bring this point home, that remembering your clients' names and remembering their key issues is important. And this becomes even more difficult when it comes to group settings where you have a group of 6 to 9 clients. Remembering each one's name for the first 1, 2, 3, or 4 sessions can be very daunting. The thing that I did, I'll just give you what I did when I did groups in order to remember names, is when I did notes, I would put the person's name and then put something that was unique about their face or their body. So, if the client had like a mole on the right cheek, or something like that, I would note that, because that was something it was kind of like a mnemonic for me. And I use those kind of mnemonic devices to allow me to remember every 9 clients' names by some unique feature that they have. So that's something that I've done in the group setting to kind of keep that names in mind. It's not uncommon, especially if you're in a group setting that has tables, to have them have them do the name tents. I have done groups where I have them put the name tents up for at least the first 6 sessions, just so that you have that, and that'll give you that that ability to kind of learn and whatnot. And that's helpful, especially when you have the table type of setting. Now, why is it important to remember your clients? It's probably obvious that it shows respect, it shows that you know who they are, it shows all of those things. But if you think about what happens either on a subconscious level or a conscious level, when you walk in a room with someone that only sees you once a week, they know you have all of these other clients, that you do other groups, you do other activities. For you to go up to them and say, "Hello, Joe. How are you doing? I remember last week we were talking about you were going to go skiing with your kids this weekend. How did that go?" If you think about that kind of conversation, that quick kind of conversation, that tells a client that you actually think about them when they're not there, that you remember them, that you keep them in your mind. And that helps build that rapport, because as far as they know, they could be just another client going through the next 60 minutes with you, and you don't care, and you're just doing this for the paycheck. And so why should they actually engage in the therapeutic process? And so that's why it's important to remember who your clients are, or be aware of them, and try to learn techniques on how to remember each of your individual clients and kind of key things that they say about their life or their personal life that you can kind of pick up on and bring up in the following week. Now, these may sound very basic and very easy, but again, in our field, it's not uncommon for a group facilitator to facilitate 3 or 4 groups, to have other duties as well. When I was doing domestic violence survivor groups, I was doing 3 groups a week. I was doing crisis intervention with 30 to 60 individuals a week. I was also the shelter manager, where I was managing at least 15 survivors with their children each week. And so this skill, what I'm trying to bring home is we are very busy professionals. And so please don't take these things lightly about making these little nuances thing in rapport building, and making sure that you know each one of your clients, and you kind of can do some type of mnemonic device to kind of remember who they are and remember what they've said to you in the past. So like I said, these sound really easy to do, but if you're in the field, it really gets difficult over time. So I want you to kind of keep those things in mind. Okay. So what we're going to do is we're going to start on these things this coming Monday, where we're going to get really deep into these things, talking about things like empathy, which we talked about with emotional intelligence, but we're going to tie it to rapport. Having an accepting manner, and talking about that non-judgment. Again, we're looking at this unconditional positive regard, digging deeper into this being unrushed and allowing clients time. And then we're also going to talk about the importance of congruency, being honest in a well-considered and kindly way. And I'll just end with this thought. Being honest is the ability to say to your group and say, hey guys, I have had a really long day. We're going to get through this, but help me along. Okay. And it's having that professional ability and that relationship with your clients, that sometimes you can't be there fully engaged, but being honest about it is important. But we also need to talk about not being brutally honest and confrontational and dysfunctional and those types of things as well. But I think we can leave this till Monday. I think would give us a little bit more time, because this is going to take a little bit more time than the time we have left. So I'm going to stop sharing and just